Assalamu alaikum and hello everyone. My name is Muhammad Samin. I'm a student intern at Life University here in Atlanta. I'm in my last year of school. It's been an amazing journey for the past 3 years. I've worked so hard to get to this point, and I've learned a lot in chiropractic and homeopathic and allopathic, and I've been to so many Gonstead seminars, and I'm specialized in the Gonstead technique. And now is the time for me to serve people. And I'll be in the outpatient clinic at the end of March. Well, I'll be there for 9 months. I can see people from the community now. And if you're in Atlanta, you'd like to get your spine and nervous system checked and treated, I'll be more than happy to serve you. Or if you want to come to Atlanta in the next 9 months, also I'll be here. From now on, I will be posting a lot of testimonials from my patients about chiropractic and the issues that they come in with, and to show how important chiropractic is from the first hour of birth all the way until death. It's really important to keep the spine in a healthy and in stage and alignment, and the nervous system always connected and working at a higher level. So my first patient that changed my life forever is now in this coming video. I will guys show you his testimonial and what he had experienced through chiropractic. And if you have any question about the videos that we're gonna watch now, you can just write the comment down below, and then subscribe to my channel and like the video, and stay tuned for the next coming videos with different patients. It's gonna be an eye-opening about what chiropractic is. And so let's watch the video first, and then I'll go and explain his case more in detail after his testimonial. I have Dustin here today. Amazing person. I've had a good experience with chiropractic, and he's gonna talk a little bit about his experience. So Dustin, when I first saw you, what brought you in?
Beyond the class, the low back pain.
Okay.
Low back pain bothered me for years now. It's been since high school, so I'd say close to 10 years, closing in on 10 years.
Okay.
And it's just back pain would just come and go, neck pain occasionally, but I would just take this as like just soreness, or just give it a rest, or stop my training altogether. But it was just constant nagging low back pain.
And then you had that shooting down the leg to the thigh.
It got so bad sometimes that my leg would feel heavy. It was like 100 pounds. It felt cold sometimes at my feet. Occasionally when I would get up after a long drive, I'd feel the tingles almost. And it was very annoying.
And how was you sleeping and all that?
Sleeping was a nuisance. I had to make sure I slept perfectly on my side with a pillow. I went from 1 pillow with no back pain to 3 with.
Wow.
So it was all adjusting without really realizing it.
And how about a little history about you? Like, what did you do growing up? Like in high school, stuff like that. You had a couple injuries, right?
Super active. Football since I was 10. Really aggressive. I love to hit, and it shows. It shows. I'd ache. But I also played football. I did wrestling. I boxed later in life.
You had 2 tear shoulder,
two
labrum tear from wrestling.
Two labrum tears.
And I want to talk about the X-rays too, and shows like how a lot of the injuries that he had in the past showed in the X-ray, whether he was talking about his shoulder or his leg pain. Particularly that leg shooting down the leg. It was a particular episode in your life that you had from lifting, right?
Yes, I wanted to be huge, so I lifted a lot. I lifted really heavy.
What age was that?
17,
Okay.
16, 17. Started lifting at about 14,
Okay.
15. And I remember squatting too much weight, and I remember like a pop sensation in my back.
Okay.
And then I racked the weight, and I couldn't stand up straight. Couldn't. So
then what did you do about it after that?
Nothing.
Okay.
I let it go.
That was 17. And then when did you start feeling the episode of the legs? Like after that?
Probably after football. I mean, coming into 18 years old.
Okay.
Graduating from high school.
So falls and slips, playing football, all that.
Right.
Okay. So we'll go over the X-rays too. I'm gonna show you guys like all the stuff, what happens, and you can see the injuries there. But let's talk about your experience. Now I've been seeing him for 3 months, and let's talk about how you progressed from the first day I saw you till today? What have changed in your life?
Immediately,
what have you noticed?
Immediately, my fiance said, "You're standing up straighter. You're more upright. You're not slouching all the time like I used to. I don't complain as much about my back hurting.
Okay.
I can lift now. Be with
Moderation.
being careful,
Okay.
of course.
And you drive an hour every day, right?
I drive a minimum of 100 miles every day.
How is driving has been after being under care?
Well, totally better. I used to fidget and move and be uncomfortable, but now I can sit in the car.
Okay. And you mentioned something through the care. You mentioned something about digestion. I don't know if you said something about your digestion.
Oh yeah, I have always had digestion issues. I thought it was just stress.
Right.
But no, after I would say 2-3 weeks of adjustments, it was I felt normal. I felt regular, I guess.
Yeah, and we can see that on the X-ray. There was a lot of constipation in the X-rays, so that's a good sign. And yeah, so that's pretty much the stories. He changed my life. I didn't know, like, literally I have him and another patient that showed me what chiropractic is all about. I've always heard all these stories and seen those stories, but now I'm experiencing it firsthand, and I'm excited for it. And I just wanted to do a video so people benefit from what they're hearing and know that there's a solution for their health always. What would you recommend for people?
Come see Dr. Muhammad.
All right.
And try it, because it really helped me out a lot.
Yes. And now as a student now, he's gonna go through it and become a doctor and then help a lot of people as well. And he knows better and more. The more he goes into studying chiropractic, the more he's gonna find out a lot about his life, and then he will be affecting a lot of other people's lives too. Well, it was my pleasure seeing you. Thank you so much, and I hope you all the best. Let's talk about his X-rays, since you guys heard his testimonial. Now, before I talk about what I found upon his examination, and then what I adjust on him on each visit, I want to show you guys what's normal, what abnormal in the X-rays. Now, this is his lower back. We have 5 vertebrae, and we're looking at it from the lateral view, like from the side. And what you can see here is L1 all the way to L5 and sacrum. And what I like to see usually, it's a 60-degree curve. In his case, there's a loss of curve because of the injury he had at the bottom that I'm going to talk about. And you can see the body is going in extension more backward that way, trying to compensate for the injury. Also, what we look at here, there's all the way from L1 to L4 discs are all healthy. You can see they're all healthy. And then we call these circles the IVF. This is where your nerve root comes out of. And then the nerve root goes to the body, organs, and extremities as well. But when we go to L5, it's one here, you guys can see there is not a lot of space in the IVF, and there's a lot of scar tissue. And the disc has been compromised. There's a lot of loss of disc here because of the injury he had. And also in the sacrum here in the back, I'd like to see a clean, nice, soft line here, but what you see is a lot of classification in the back of the sacrum. He had an older injury too. It could be from football, like falling and playing football, or even younger age having a lot of falls and slips. And then when we look at the anterior of the body, you can tell there's a lot of digestion issues. All this constipation here due to subluxation first, and then second the gut flora and all that stuff. But mostly it's subluxation. I'm going to show you guys how all his subluxation affected this digestive issue. Now this is the lower back, looking at it straight, and you can see there's a lot of deviation. Now L5, this one right here that we saw from the side, works as a foundation. The L5 and the sacrum and the hip and the pelvis all are foundation to the spine, and especially L5 has the most biomechanical extension and flexion and to the spine. So if there's any problem that happens in most people, a lot of people had it between L5 and S1, and when L5 get compromised, everything above L5 get compromised as well, and the body trying to stabilize it. You can see there's so many shift in the spine, and especially in this area between L1 and L3. Now this happened if you think about L5 as your spine as a 24 story building, and then L5 is like the foundation or the stone of that building. If it's not stable and aligned properly, everything above it trying to like compensate, and that's what happened in his case. So this is nothing much in the like B to A of the spine. Now you can see here the deviation we talked about. I'll talk about the subluxation later, and we can still see the digestion issue all around. Let's go to the bulbous. This is also the bulbous in this case. He didn't have a lot of misalignment in the bulbous. He had his right hip, well, it was misaligned, superior and exterior. We call it ASEX, and we worked on that too. I'll talk about it in a minute. But this is how we do it in Gonstead. You take the measurement for the bulbous. As we said, it's the foundation. He had a rotated sacrum here also. His sacrum was rotated this way, and this is the listing that we adjusted L5 on him. But the sacrum was not that significant upon examination. Now we finished from the lumbar. Let's go up the thoracic area, up the chain. You can see here also because of the deviation that happened from L5, his body's compensation here as well. You see there's like a curve going this way from T7, T8, and then also coming back here at T1, T7. C7, T1. So all this stuff is compensation for what happened earlier. If L5 was corrected earlier, that disc could have been much bigger than what it is now. It's probably now about, I'd say that's like a D4, D3 disc. So it could have been easier to be preventative if he had chiropractic earlier. But now we can prevent this from going farther and not having him had the surgery, because if this was a 10-year injury, if he lifted alone for about 20 year more or 10 year more, I guess he'd have a surgery at that time. And now, since we talked about the thoracic and lumbar, let's talk about his cervical. This is the lateral view of the cervical. You can see there's a lot of straightening in the neck. The neck is not like 60 degrees. Also, all this stuff happened compensation for what happened below, and there's some like misalignment as well in the like vertebrae itself. But his problem was T1, C7 area, and we worked on that. And also the atlas. If you look here, go back to the upper cervical. This is where the spinal cord comes out of the brain and goes through the body. He also had an atlas on the left that was really severe on examination. Now in Gonstead, there's 5 criteria to analyze the spine and adjust every time the patient comes into the office, so we can follow up with the nervous system. So we use this scope, one of the criteria, to find where there is different heat on the spine and where there's nerve pressure. My hand on the back of his back, I can feel a lot of heat, but it's not specific, it's too broad. This machine, the nervous scope, picks where exactly the heat is and allow me to further investigate that area. So we use the motion palpation, static palpation, and you can watch Dr. Sue or Dr. Rahim or any Gonstead doc on YouTube and see how they use the analysis. Now the first visit he came in, he had a really high pressure at the atlas bone, and that atlas bone controls a lot of stuff because the vagus nerve comes out of here, and the spinal cord goes through that, and the vagus nerve controls so many stuff. His anxiety could be from here, and also his bowel movement into intestine, his stomach enzymes, and the HCl and all the enzymes that work on the food could be from here as well, if that nerve is not working or there's a pressure on the area. I found C1 on him. I've also found C7 on him. That area was a lot of it was chronic, so it wasn't really restricted in the beginning because he had 2 labrum tear from wrestling, and that would indicate a problem here. I was assuming there's going to be a problem because he had 2 tear labrum, and that area mainly controlled the shoulders from C7 all the way to T3 and 4. And then he had also T7 and T8. This T7 vertebrae was a lot of heat also with the device, and it was restricted and edema, and it was tender. And that area control the stomach. It goes directly from T6 to T8, all control the stomach. It can affect the sphincter of the stomach, it can affect the enzymes as well, and the bowel movement, a lot of stuff. And also then we found on him where the kink is, L1, that also can affect a lot of digestive issue in the bowel movement. And then L5 mainly can be the bowel movement. So there's no one answer for the body because it's all connected. As you can see the back here, there's like the body is like a huge network of nerves. So a lot of stuff can be affected from so many different areas, but in Gonstead we focus on where the main subluxation were. And because he wasn't able to sleep, he also, I forgot to mention, he also had the right hip was stuck, the ASEX. So because he wasn't able to sleep, the first visit I wanted to go parasympathetic, and we know parasympathetic control everything, digest and rest. What I adjusted on him the first visit was his atlas bone, this one on top, and then I went all the way to the bulbous to stay in the parasympathetic. Your parasympathetic is between in the cervical and then in the sacrum and the pelvis. This is the parasympathetic, what keeps you in digest and rest state. And I didn't want to work on his thoracic area where the sympathetic problems are. So we continued later on because that was his first visit, and he told me that he slept really good. And then the second and third and more on, we start working on the other stuff. But I stabilized his pelvis first, then I adjusted L5. The L5 was a huge adjustment for him, because when we adjusted it, what happened is he started walking, and he told me like his pressure went off his leg, and he went home and drove for an hour for the first time without bothering, and he worked out normally. So L5 is a major bone in the spine, as well as the C1 atlas. A couple of times. C7 is gonna be a minute for him because it's chronic. It's been there for a minute because of his shoulder problem, and then the compensation having this for years and years. So it's like it took a minute. It was a process of healing of from all the traumas he had through his life, and it took about 2 months at least to get everything stabilized. But he started feeling everything from the beginning. Like from the second session, he's like, I'm sleeping different, I can walk different, I can feel taller. That's what you guys heard, right? So it's important to keep the spine intact from an early age. And this is your nervous system, autonomic nervous system. This is what runs you and control everything in the body without you controlling it. And we have a parasympathetic and then the sympathetic. If we see the sympathetic here, it's what give you the fight and flight, and parasympathetic digestion and rest. So it's mostly everything in blue, it's in the parasympathetic, and everything in yellow is the sympathetic. And you can see where his L5 and the pelvis control the parasympathetic, the digest and rest, and also the atlas. Here the vagus nerve comes all the way. It controls a lot of stuff, and that's from the heart to the lungs, to so many stuff. So atlas is really important. The L5 is really important vertebrae to stabilize the spine, and then all the stuff in the middle is really important for so many health factor in the body. But as you can see, everything is connected. There is no cookie cutter for anything. You cannot. So that's why I don't care about the symptom. I care about the health of the spine, and to know when to adjust, when not to adjust, and how to adjust it to keep everything intact. And that's Dr. Gonstead right there. This is the famous saying of him, saying the most important part of getting people well is to take your time, give them the utmost of your ability as a chiropractor, find the correct subluxation. You have to find it first, and then accept it where you find it, correct it, leave it alone. That's what differentiates Gonstead from any other techniques, is knowing when to adjust, when not to adjust, and how to adjust, and when to leave the bone alone. And that's what Dr. Gonstead was famous for. He was known as the chiropractor, where he helped all the difficult cases that nobody could take care of because of his. I was able to deliver the message easily, and this is what chiropractic is all about. We don't care about the patient symptoms. What I care about is how healthy the spine is. And when the spine is healthy and the nervous system is working at optimum level, the body can heal itself, and that's the principle of chiropractic. And in Gonstead technique, we care about the foundation of the spine, because everything above it rely on that foundation of the pelvis and the lower back. In his case, he had the subluxation at the atlas, and the atlas is so important for the message to go through the spinal canal from the brain to the body. So I had to adjust the atlas first, because if that was not clear, none of the message will come down through the spine and to the body. And then I stabilized the pelvis for one visit, and then the 2 other visits we worked on L5. And then after that, I started monitoring the thoracic area, because there was a lot of compensation from the chronic subluxation for years. So we had to work on the L1 and T7 and C7 and just watch it and adjust it accordingly. And everything was amazing with him. And this is what chiropractic about. And I'm excited for the next years of my life and what's gonna happen, changing so many lives. And I'm gonna be practicing until the day I die, because it changed my whole life, and I can't wait to graduate. I'm now going to be in the clinic, as I said, and I'm really excited to serve so many people. So if you're in Atlanta, you can come see me, or if you want to come to Atlanta for the next 9 months, I'll be more than happy to take care of you. And stay tuned, subscribe here, and write any comment you want, but stay tuned for the next coming episodes, where we're going to show more cases and help a lot of people. Thank you so much. Have a good day.